Welcome. This presentation is for the e-patient. This YouTube presentation will discuss information technology for the e-patient, quality and safety in healthcare for the e-patient, pros and cons for the healthcare delivery for the e-patient, and future technology evolving over the next 10 years for the e-patient. The term e-patient was first coined by Thomas Ferguson in 1975 as a way to describe patients that were equipped, enabled, empowered, and engaged in their healthcare. Today, it describes the patient that uses technology to manage their well-being and healthcare needs. There are three categories of the e-patient. The well are people using the internet to find prevention and wellness techniques. The second category is the newly diagnosed. These are people looking to understand and manage their diagnoses. The final category are the chronically ill. These people are looking for support and resources for their illness or condition. Our role as providers is to teach patients how to find quality resources online for their healthcare needs, as well as how to keep track of their records using technology and the dangers of self-diagnosing. A study published in the BMJ showed less than 30% of diagnoses from a symptom checker are correct. E-health interventions aiming at fostering patient empowerment can only show impact when healthcare professionals are willing to engage in a true partnership with the patient, and when patients are willing to take over responsibility for their own health management. Patient safety should be the healthcare professional's #1 priority in our field. The Institute of Medicine states 6 domains of healthcare quality. They are safe, effective, patient-centered, timely, efficient, and equitable. Thus, safety is the foundation upon which all other aspects of quality care are built. Quality and safety in healthcare for the e-patient. Empowerment is the process of increasing the capacity of individuals to make choices and to transform those choices into desired actions and outcomes. This is what an e-patient truly is. Education is going to be our strongest tool when it comes to patient safety and empowerment. The more involved and educated a patient is on their own health, the less likely the chance of adverse reactions can occur. A patient that knows all their medications prescribed and their purpose and adverse effects can prevent medication errors. A patient that knows risk factors involving their disease process can modify them and save their health. Knowledge is power. Educating our patient empowers them to take charge of their health. At the end of the day, our jobs as healthcare providers is not to keep the patient at bedside, but let them be independent and proficient enough to care for themselves. E-patient benefit and drawbacks. Healthcare delivery. E-patient benefits. Patient healthcare data empowers the patient to be informed and take part in their own care while in the comfort of their home. Patients can review information for medical errors, such as medical histories and medication. Patients have the ability to share health information with family members and other relevant clinicians. E-patient drawbacks. Complicated health information causes concerns for the patient. Clinicians sometimes make observations about the patient that may not be received positively by the patient. Medical terminology and notes may be misinterpreted. Evolving future technology in the next 10 years for the e-patient. The top 10 targets for wireless medicine for monitoring chronic diseases in the future include Alzheimer's, breast cancer, depression, diabetes, COPD, heart failure, hypertension, asthma, obesity, and sleep disorders. The e-patient has the availability to have an e-visit when sick and never leave the home. Devices are being developed to attach to your smartphone or mobile devices to take your vital signs and relay this information to your physician. Expectant mothers can be monitored by their doctors while laboring through Fetal Link. Implanted glucose monitoring devices can monitor your glucose by scanning the device. A Band-Aid wearable device is currently being developed to do the same. Mobile phone apps have also been shown to benefit patients in a range of interventions across numerous medical specialties and treatment modalities. Examples: patient-centered apps allow patients to access personal health records, manage appointments, manage medications, and communicate securely with a care team. Health insurance apps. Many health insurance companies offer apps where you can manage your policies, locate medical professionals, provide a health checklist with recommendations, and 24-hour availability to talk to a nurse. Devices for wellness promotion. Fitness monitors like the Fitbit monitor steps, daily activity, and sleep cycles. This encourages individuals to maintain an active lifestyle. Propeller is a sensor device that attaches to an inhaler. It is capable of monitoring air quality, measures spirometry, tracks medication usage, and assists the patient to recognize triggers and symptoms of asthma attacks. L'Oreal UV Sense is a small thumbnail wearable device that measures UV exposure so individuals can take simple steps to protect their skin. Devices for early detection. The Apple iWatch 4 has been approved by the FDA as a Class II medical device with fall detection, low heart rate alerts, and personal ECG monitoring. The Cardioband provides a sensor that takes a 30-second ECG reading that can help detect atrial fibrillation episodes. The IT bra is a bra insert that monitors circadian metabolic changes in heat that correlate to accelerated cellular activity common in breast tumors. In conclusion, the millennial generation are known as the digital natives and will drive the advances of healthcare toward a more technology-inclusive industry. Millennials are still light users of healthcare because this age group is still young and healthy by and large. But as they use healthcare facilities more, they are starting to demand technology-savvy service. Within 10 years, as millennials age, there may be an increased demand in better and safer e-patient technology.